Today we honor and thank all of our veterans, and for some, their job isn't over yet. 8 News Now reporter Sally Jaramillo spoke to some veterans in the medical field who say their experiences keep them going during these very difficult times.
We didn't get a choice in this war. This war came to us.
With COVID-19, this is what we would probably describe our third wave. But now we've got a better handle on what we're dealing with.
From the front lines overseas to the front lines of the pandemic, Ben Rockcliffe, the director of critical care at Southern Hills Hospital, says as COVID numbers increase, he is using past experiences in the present.
So I was a combat medic in the Army from 02 to 06 with the 101st Airborne. During that time being deployed overseas, you can kind of relate to the pandemic situation. It was something that was new when you're young, going over to a war zone. Lots of unknowns, almost 14, 15 years later. It still comes down to, in the hospital setting, very much patient focused. They're our number one priority. But relating that to the military, it's all about the person to your left, the person to your right.
Dominic Martinello is the chief medical officer also at Southern Hills Hospital. He says the military taught him to work as a team, and teamwork is part in battling COVID.
The hospital is like a cavalry unit. You take a bunch of people that are all from different backgrounds, that have different jobs, and put them all together, and they have to accomplish one mission.
Martinello also says gathering intelligence like he did back in the military also helps in treating those who get sick.
We're actually pulling in all the research that we can possibly get. There is a tremendous amount of data that needs to be brought in from multiple specialties and all assimilated so that we can develop treatment strategies for these patients. The only way that we're ever going to actually win this war is that if each and every person who's capable of fighting does.
Sally Jaramillo, 8 News Now.
Sally, thank you. Because these veterans see so much firsthand, they do want to share the message to continue to do your part wearing a mask and limiting group gatherings.